Now, the fight against Ebola yielded more fruits, as at September 17, the total number of confirmed cases of EVD in Nigeria was put at 19, 15 in Lagos and 4 in Port Harcourt. Unfortunately, the total number of deaths stands at 7, 5 in Lagos and 1 in a private hospital in Port Harcourt. These figures remained unchanged, and on October 20, the World Health Organization declared Nigeria Ebola-free.
May their soul rest in perfect peace. Please be seated.
This news conference is unlike several others that have been organized by the Health Ministry in the past. The gathering is to witness the World Health Organization's public announcement of Nigeria as an Ebola-free nation.
Today, 20th of October, 42 days, it means twice of the incubation period. After the last confirmed case of Ebola virus disease was discharged from the isolation ward, having tested negative for the Ebola virus, the chains of transmission have been broken. WHO officially declares that Nigeria is now free of Ebola virus transmission. We need to continue sharing the Nigeria's experience and country's expertise to help other countries to urgently contain the Ebola epidemic and supporting others in their preparedness and response plans.
This risk and the risk to other countries can only be eliminated through the setting up of a system similar to the Nigerian one under the leadership of the United Nations, but with the operational wing built around ECOWAS.
But having successfully conquered Ebola, what's next?
Awareness is enhanced alert system, getting prepared, for eventualities and make sure that it doesn't come in again. But if it does, we should be able to really, round it up even faster.
With Ebola virus disease still ravaging some West African countries and cases of the disease in Europe and the United States, vigilance, especially at the entry points, must be taken seriously to avoid new outbreaks of the disease.
For the first time, the Lagos State government hosted survivors of the Ebola virus disease.
Beyond the fear of the Ebola virus disease, the issue of stigmatization persists. And this meeting between the members of the Lagos State government and survivors of the disease is to help with the problem.
We wondered why we did this. The essence basically is that we need to remove this issue of stigmatization of this disease. There's a lot of fear in the polity, a lot of ignorance. If we don't do it, all of things are captives of this situation.
Let me congratulate you, survivors. I felicitate with you and with all members of your family, your friends, and your colleagues. Incidentally, today is the last day, and hopefully by midnight today I will get confirmation that the last case of those that is under surveillance, those are those who have had contact or who are not ill, we are tracing. Today is the last day, and we hope to get confirmation tonight that the last case is also clear.
Here, these people who feel fortunate to be alive relate their experiences and express their gratitude to those who helped control the situation.
When everybody was running a helter-skelter about the fact that I had direct contact, I did not have direct contact, I told myself, I only opened the door.
I must say I'm the greatest. I should be the happiest person on earth today, because I didn't know, as at that time, I didn't know I was going to be alive till this time. It all started because I was the person that received Patrick Sawyer the day he was rushed to first consultant. That day, it was just like a joke.
Meanwhile, for First Consultant Medical Center, the private hospital that helped in nipping in the bud the spread of the Ebola virus, getting back on track is crucial, and a visit by the Lagos State Governor Mr. Babatunde Fashola, was meant to reassure the public that the hospital is back at doing what it knows how to do best, which is taking care of the health of the people.
The owners of the hospital are here anyway. They're not on a suicide mission. The doctors who got infected here are back at work. And so people who still choose to fear what they don't know, there's not a lot we can do but to continue to encourage them. But some people have taken the first step forward. Now, if doctors, medical health workers who did not need to be here, who left the comfort of their own countries and their own homes, came here to help us, what stronger sign can we give of our appreciation to what they have done than to get up and make them proud that they haven't acted in vain?
We deal with human beings, and our job is to save lives. In the process, we put our whole institution on the line, and we lost lives. So, whereas we saved a greater catastrophe from the country, we suffered an internal problem, losses within our family structure as a hospital.
What would you tell the people watching right now that First Consultant is back on its feet?
First Consultant is back. It is back.
While Nigerians are rejoicing over the Ebola-free status of the country, the bottled-up issues between the federal government and the joint health sector unions busted, and this resulted in the ongoing indefinite strike by all other healthcare workers except the doctors.
In the struggle for our members,
once again, the disagreement between the health workers and the federal government rears its ugly head. The joint health sector unions have down tools all over the nation. They say this time the strike is total. Locked doors, empty halls and hallways at the psychiatric hospital in Lagos, Yaba, and the Federal Medical Center, Ebutemeta, suggest the seriousness of the situation. The issues of skipping of CONHES 10, call duty and hazard allowances, as ruled by the courts, are still the bone of contention here.
We went to court on 5 issues and won the 5 issues from the National Industrial Court of Nigeria. The issue of consultancy. The health professionals are asking for consultancy in their respective, professions. In your profession, you cannot get to level 17. It's only doctors with MBBS, first degree, that get to level 17.
We started before the doctors agitating for this, and it's as a result of our struggle that government was about to answer us and doctors opposed it.
The supervising Minister of Health had earlier said that it was wrong to abandon ongoing negotiations to embark on a strike.
Government has shown commitment to the cost of the health workers, and the high level of body was working on the issues with Johesu. Up to the last meeting on the 6th of November 2014, there had not been any disagreement of any fundamental nature to warrant the strike action.
Dialogue, first year, second year, third year, this is the 4th year.
These patients at the psychiatric hospital came for their drugs, but there is no one to attend to them, so they wait. Hear why this elderly woman at the FMC Ebutemeta has been discharged.
I'm taking her home because of the discharge, because of the strike.
It seems just when the doctors have got what they want from the federal government, the health workers go on strike, and vice versa. And either way, the patients end up being hit.
And so the year is ending with the joint health sector unions still on strike. When this will end, the answer is with the federal government and Johesu. But let's end on a bright note. News filtered in early December that the National Health Bill has been signed into law by President Goodluck Jonathan. Although there are no pictures or videos made available, the President's senior special advisor on media and publicity, Mr. Reuben Abati, confirmed this.
It's been signed into law. And the President did that weeks ago, I think more than 3 weeks ago, or thereabouts. So what the President has done is to endorse what is, being and what will serve the best interest of the health sector and move the health sector forward.
I'm sure many Nigerians will be looking forward to the full implementation of the National Health Act, which, among other things, captures the legitimate aspirations of Nigerians for improved access to quality healthcare services. And that's how we wrap up Health News for the year. Looking forward to a more fulfilling and healthy 2015 and a rancor-free one for Nigeria's health sector. Thank you for watching and see you in 2015. I am Yomi Otaigbe.